Okay. So sometimes that may be those kind of spinal cord compressions may be leading into irritation of this meninges.
Now we are going to see about Kernig sign. Kernig sign is a clinical test to rule out the meninges irritation, which is seen in meningitis and subarachnoid hemorrhage. Okay, let's see the procedure. Here is our model where he keeps his hip at 90 degree and knee at 90 degree perpendicular to each other. Can you keep your hip at 90 degree and knee at 90 degree? Then the therapist do knee extension. Okay, you can extend the knee. Where if the patient feels any kind of pain or irritation along the posterior thigh, the test is positive.
Okay. When we are thinking about this irritation only, we get to remember some other things. That is spinal arachnoiditis. What is that spinal arachnoiditis? Means we have these three meningeal layers. What is dura mater, pia mater, and arachnoid mater. In that, particularly we are speaking about that arachnoid mater. Why? Because that is in the central one that is very closely related to CSF, subarachnoid space in CSF. Okay. So what will happen generally means the patient may be having previous surgery. After that surgery, maybe for example 5 to 6 years back, they may be having any kind of small surgeries that may be produced as scar tissue. But that scar tissue may be irritating this area. So that will produce inflammation. Okay, itis, arachnoiditis, right? Spinal arachnoiditis. That means what? Arachnoid membrane is going for inflammation, right? Spinal arachnoid membrane is going for inflammation because of the previous set 4 surgical scar may be irritating this arachnoid membrane that may be producing the inflammation and which causes arachnoid inflammation, arachnoiditis, right? Got it? Or else sometimes that may be produced because of CSF. The CSF may be containing some inflammatory debris. Why, sir? Maybe because of any previous infection. What is that, sir? That may be because of virus, bacteria, or any pyogenic material, pyogenic germs or something, or else already previously they may be having, for example, viral meningitis. Viral meningitis, which will be affecting the upper cord than the lower spinal level, cervical region. They may be having stiffness, fever, and rigidity, right? Stiffness, fever, rigidity, and headache will be there. Kernig sign will be positive. Why? Because in viral meningitis, that is going to affect the meningeal membrane, especially, particularly, the arachnoid membrane is going for irritation, inflammation. Because of that inflammation, it produces thickness and tightness. Because of that tightness, when we are trying to flex and move the patient's head like this, that will be producing hyper-irritation. So when we try to flex the head, the patient will feel immediate hyper-reflex of headache, plus they try to bend the knee like this. That is called Kernig sign. Okay, so Kernig sign positive in viral meningitis. Why I am telling you this? Because when the entire meningeal covering is going for inflammation, the inside we have spinal cord that is not able to freely move. Couldn't understand? We have a pipe. Okay, we are going to insert some other refill or something, anything, some tight material inside that. Suppose inside the pipe, when the pipe is so lubricated and fine, when it is smooth, you can be easily inserting anything inside it, right? Got it? Suppose if it is not properly lubricated and it is so dry inside, when you try to insert your finger or something, it will be so dry. It is not moving easily. For example, a ring. When you are trying to wear a ring, if it is not smooth, it is not going to fit inside smoothly. So what you will do? You will apply some oil or you will apply some soap or shampoo. After that, you will try to put it in your fingers, right? The same way, you try to lubricate it. Why? Because the covering should be very perfect, fine enough to lubricate and smooth gliding, right? So spinal cord will be inside. So it should be smooth for the movement of the bodily movements. When there is any movement, there will be micro level movements in the vertebral foraminal neural output as well as the spinal cord entirely. If it is not there, again and again, it will be producing some, for example, here, there is any inflammation. Again and again, it is going to produce some rubbing. So again and again, there will be inflammation. So the inflammation is repeated vice versa, right? So this is not going to happen. So that may be produced because of virus, bacteria, or any kind of previously attained meningeal irritations. Okay, and trauma, for example, you may be undergoing any trauma, accident or something. Some piece of any metal or something is stuck inside your leg. Luckily, you got nothing is severe. Your spinal cord is not severe and you are fine. But anyway, that is actually stuck inside the vertebral column, just touching the meningeal covering. Suppose imagine that is touching the meningeal covering and reaching the spinal cord like this. Whenever you try to move, that will be irritating, right? So that will cause continuous rubbing of meningeal membrane. So that is also going to cause irritation.